And today is the first Monday of May, and it's known as Melanoma Monday. It is a day to raise awareness about melanomas and the dangers of skin cancer. Senior health correspondent Monica Robbins explains what all of us need to know.
Melanoma, of course, is the deadliest form of skin cancer, but it is treatable if it's caught early, and that's why Apex Skincare is offering free skin checks at its locations across Northeast Ohio. And I'm joined by Michelle Chizelka, who is a physician assistant with Apex Skin. Thank you so much for being here because we have a zillion questions.
Absolutely.
Okay, so I've been seeing this all over the internet. What is the ugly duckling sign?
Yeah, so the ugly duckling sign, when I'm doing a skin check, I'm looking for something that doesn't look like the rest. So what's looking darker, what's looking irregular, what's looking like it shouldn't be there on the body.
So what should people pay attention to?
Yeah, so people should pay attention to things that are changing. So things that are changing size, shape, color, things that are bleeding on their own, changing rapidly, new moles that otherwise shouldn't be there. We like going through the ABCDEs of melanoma. So A is asymmetry. So if you stick a mirror right down the middle of a mole, what should it be looking at like on the same side? Should it be reflective on the same side and be even? B is border. So border is, we want it to have a well-demarcated, well-defined edge. We don't like things to be blurred, notched, or jagged. C is color. So we like to have a light brown to medium brown tone, nothing that's super dark or even black in tone. And then D is diameter. So I always tell patients to keep it easy. If you look at the head of a pencil eraser, that's about the size that we want something to be. And then E is evolving. So any of the above that I just talked about, something that is changing size, shape, color, new things that are there, and things that otherwise shouldn't be there.
So if you do notice anything odd, what do you do?
So if we notice anything odd, it's a really quick biopsy usually. We just numb the area. The numbing, I always say it's very easy. It just burns for maybe 3 to 5 seconds, and then the numbing kicks in very quickly. I take a very tiny blade and I just scrape off the lesion. It's very simple. We put a little Band-Aid on there at the end, and then the patient goes home. We know results in about a week or 2.
So what happens if you get positive results?
So it depends what it is, of course, but if, say, something would come back as a melanoma, we have very skilled surgeons that actually work at our company at Apex Skin, and they're able to get the patient scheduled very quickly and get that melanoma cut out for the patient.
Is surgery just the only option, or do patients also need radiation and chemotherapy and all the other things?
So it depends how deep the melanoma is. Our borderline is usually about 0.8 depth. If it's anything past that 0.8 depth, we get the patient to like an oncologist.
So you would know if it metastasized, if it's deeper, or
Correct.
is that the, okay.
Correct. It sometimes needs a little bit extra.
So melanoma isn't the only thing we have to watch for, though, is it?
Correct, yeah. So there are other types of skin cancer. There are basal cell skin cancers called BCCs, and then there's also squamous cell skin cancers, which are called SCCs. So BCCs, I always say patients, that's the one you would want. It's very localized. They don't spread anywhere. They just stay right where they are. Worst case, they'll get bigger and bigger and kind of take over that area. Squamous cells have a little bit more of a chance to spread other places, but still very low risk. And then the melanomas are the ones that we really can't miss.
Do they look any different than obviously the melanoma, what you described?
They definitely can. Melanomas are usually dark, very jagged. They're growing very quickly. Squamous cells and basal cells are usually red, very scaly. They can bleed very easily and that kind of thing.
I think a lot of people think that, you're going to get a melanoma or a basal cell where the sun hits,
Absolutely.
Right? Is that always the case?
So I would say usually it is. However, there's definitely cases where, I find things on the buttocks, I find things on the back that patients don't know that's there. So definitely always a good idea to get in at least once a year with your provider and get the full body skin check, because there are places that, we miss at home.
And so what else should people be doing? Because we keep hearing sunscreen, sunscreen, sunscreen.
Yeah.
Is that the only thing we should be doing?
So sunscreen's very important. It's something that everyone should be doing. I like to put it on in the morning before you leave for work or school, and it's there for the whole day. However, if you are going to be out for more than a 15-minute period, it's always a good idea to get that on there at least 15 minutes before you leave the house. And we like to reapply every 2 hours. I always tell patients too, if you can avoid the 10 a.m. to 2 p.m. time frame, that's really the area where the sun's at its strongest, and you really want to avoid that time. But if you are out, just seek shade when you can. Use hats, sunscreen, and that kind of thing.
All those people who love to lay out in the sun,
Yeah.
don't mind getting, you know, the theory that getting burned turns to tan.
Right.
And maybe they did that quite a bit when they were younger, you know, asking for a friend. What do you want people to know about that if you have had sunburns in the past?
Yeah, so getting that base tan is a very big myth. Please do not do that. You're still increasing the amount of sun rays with doing that. With SPF, you want to be at least at a 30 SPF to a 50. Really anything above 50, it's just kind of a number. You really want to stay between that range. 30 SPF gets you about 97% coverage, 50 gets you a little bit more, but nothing's at that true 100%. People with a history of blistering sunburns, of history of tanning bed use, a lot of people don't even know this, but even one time in the tanning bed can increase your risk by 20% of melanoma. So that's huge.
Wow. Wow, I did not know that.
Yeah,
That's really scary, especially for people who are still using tanning beds. What would you tell them?
Definitely stop. I think, you know, even driving down the street, I'm seeing less and less of the tanning bed places, but you are really putting your skin at more risk. You are not only damaging your skin, but you're aging faster as well. So, you know, my patients who start young with a sunscreen, they definitely look a lot different at 60 years old compared to someone else who's been doing that their whole life.
Are spray tans okay?
They're okay. Yeah, definitely spray tans have come a long way. The self tanners too. So those are definitely a safe option if you don't want to be doing the tanning beds for sure.
That's what everybody heard in this final interview. All right, Michelle, thank you so much for
Thank
your
you.
insight. We really appreciate
Of
it.
course. Thanks for having me.